Just who are you then, please?
I'm John Storr, and I'm a retired pediatrician.
And so, for how long were you a paediatrician?
Consultant pediatrician for about 25 years in Carlisle at the Cumberland Infirmary. Though obviously I was doing paediatrics at various other places before that as part of my training.
Because you sound as if you are from South Africa?
That's correct, yes. I grew up there, I qualified there. I worked for a couple of years there before coming out to England.
And have you done anything else in your time other than being a doctor?
In between South Africa and England, I worked for about 14 months in a circus as a trapeze artist, trapeze catcher.
Really?
Yeah. Yes.
So tell me, and going back to being a doctor, you must have seen a lot of changes in the medical profession in your time so far.
Well, obviously, as well, there were tremendous differences between South Africa and medicine in England. I wouldn't say necessarily one country came out better than the other, quite frankly. There have been immense changes, I think, in the professionalism in many ways in England, for example, in the way emergencies are handled, with everyone having the same type of training. So everyone knows what they're talking about and who's in charge in an emergency situation. And that certainly wasn't the case the first time I attended a cardiac arrest in England, for example.
Really?
Yes.
And has technology played a part in all of this?
It's playing an increasing part. I don't think I've seen got a great insight into some of the amazing things that happen nowadays that happen really in the more major centres. But obviously imaging has changed dramatically. I can remember in Cape Town having somebody with a bleed in the brain, for example, and we were using some simple pinging ultrasound device to try and work out if the centre of the brain had shifted at all. And then a week or two later we had the first CT scanner and suddenly had a magical picture of the whole brain and knew exactly where you had to go to drain the blood, for example.
Gosh. So in your opinion, what makes a good doctor? What are the qualities?
Obviously, there are many areas in which doctors can work, but obviously you have to put yourself in the mind of the patient. I mean, explanations are very important. Also, there's a tremendous skill to getting information out of people, and that applies perhaps to children more than anyone. So I think there are personal qualities which you build up over time. And I think which can also be taught to a far greater extent than they were taught. I mean, the art of breaking bad news, for example, is now an actual subject where it was something we just had to pick up as we went along in my training.
And you were a pediatrician?
A consultant pediatrician in Carlisle, dealing with all ages from premature babies up to older teenagers.
And you were saying one of the arts is to find out what's actually wrong. So yes. Is there a skill in talking to a 5-year-old or a 6-year-old to find out?
Certainly there is, and sometimes it's a skill to getting information from the child and not having the parents butt in the whole time, for example. One of my colleagues used to sometimes start off his consultations by talking to the child and say, "Who have you brought with you today?" Which is, I think, quite a good line, particularly if you're not quite sure if they come with mum or granny.
Right. And do sometimes children have a different view of what's wrong than their parents?
Yes, they certainly can sometimes.
Wow.
Yeah.
How fascinating. And who'd have thought it's a trapeze catcher?
It was certainly a very interesting thing to do for a while. I must say, when I first applied for a job in England, I didn't mention it at all. I simply said I had been travelling, whereas afterwards they said I should have told them, and I might have got the job straight away without any discussion.
Fantastic. Thank you so much.